You're listening to Clinical Conversations. I'm Joe Elia. Your response to our series on the lessons of the April 15th bombings at the Boston Marathon has been gratifying, and we continue that today with another physician who is just starting his shift at Boston Medical Center when bombing victims began to show up. Dr. Andrew Ulrich is an associate professor of emergency medicine at Boston University School of Medicine and executive vice chair of the emergency department. Welcome, Dr. Ulrich.
Thank you.
As I said, you just started your shift. When you think about that, what do you tell yourself about that day now, a few weeks later?
You know, it certainly leaves left a lasting, mark in all of us who were here and participated in it. You know, it started off like any other marathon day. We are quite accustomed to here in Boston that Marathon Monday takes on a kind of unique place here. It's a bit of a holiday in town, and everybody celebrates. And, us in healthcare, and especially in the emergency department, we anticipate a little heavier volume on those days because we tend to get a lot of the runners.
Yeah.
So, we started the day like we did most other Mondays, Marathon Mondays. It's just, enjoying the day and waiting for the runners who had run a little too hard to come so we can make them feel better and congratulate them and send them off on their merry way. And then at around 2:55 or thereabouts, the world changed for all of us.
Yeah. Something similar happened yesterday at near Oklahoma City, didn't it?
Yeah.
If you could tell those clinicians and physicians there something that you'd learned from the marathon experience, what would it be?
Wow. I think the one thing that I took home more than anything is just the strength of the people who were involved on both sides of this equation, the strength of the people, the victims who came and what they went through and what they faced, and equally so the strength of the people, of Boston and people of Boston Medical Center who, stepped up and were just unbelievable in their response to this event.
You had, as it turns out, you were probably double-staffed, right, because it was at the shift change.
Yeah, it was a very unique, I wouldn't say unique, it was a very opportunistic, if one might say that, about the event and when it happened, where it happened, and the scenario around it is, anytime things occurred, change of shift, which tends to be 3 o'clock in most hospitals and emergency departments, we have double shifts there. So we have a lot of people around, a lot of people already here. Some were coming, some were leaving, but we really had a heavy load of people. The other thing that made it kind of interesting is because it was Marathon Monday, and again, it's a bit of a holiday here in Boston, that, other things were not what they would normally be on a very busy Monday. The rest of the hospital was a little less filled up, so our ability to use the hospital, the other resources like the operating rooms and the ICUs, was a little bit more easily managed because it was a Monday. And the other thing which made this event, or made the scenario and the specifics of this event even more interesting was, because again it was the marathon, we here in Boston in the healthcare world sort of really prepare. So we have a lot of resources at and around the marathon, and especially the finish line. So we had a lot of extra people there. There's a medical tent that was right down the street. There were a lot of ambulances and a lot of, health personnel around and about the area because we anticipated just the normal marathon event. And then when this occurred, we were able to mobilize very quickly.
You probably had people within 10 minutes of those explosions, didn't you?
Yeah, we, normally in disasters, there's at least some delay between the event and the arrival of patients at the local hospitals, nearby hospitals, because it usually takes some minutes and stuff to coordinate and figure out what's gone on and to grab the patients, triage them, and then ship them out. What was different about this one is because of, again, the specifics of having so many people there, these patients were literally scooped up from the blast site, put in ambulances, and brought right out down to the hospital. So, our initial notification of the event really occurred by one of our colleagues who was up at the finish line and called on the cell phone and said, hey, something just happened, get ready.
Wow.
And the official notification by the medical people there occurred maybe 10 minutes after that, and within a minute or two of that official call was when the first patients rolled in the door.
You have how many residents do you have in the department?
So normally at any one time we would have about 7 or 8 residents and 3 or 4 attendings.
And so you probably had a similar number, except the shift change. There was some overlap there, right?
Yeah, there was some overlap. So at the time we probably had 13 or 14, maybe 13 or 14 residents and 4 or 5 attendings there. But what was remarkable is as soon as word got out, and we did a part of that by putting out a disaster call from the hospital very quickly after the event, people were coming from all over. So our staff, not just the emergency department, but just people throughout the hospital, came to the hospital to help. They came from all over. Some were at the race, some were running the race, some were in the neighborhood, some came far away. But within a very short period of time, we went from having, 9, 10 residents and 4 or 5 attendings in the department to 40 or 50 physicians, attending level physicians in the emergency department. And that was within 20 to 30 minutes.
The emergency departments in Boston generally drill for these events, don't they?
Yes, I think most, if not all, hospitals actually do drill. It's part of, what our requirements are for hospitals. And you can drill and prepare, and we do. And I would say that our folks here do a very, very good job of helping develop, disaster management and planning. And so we do drill. We've done a lot of what we call tabletop drills. We've done a lot of mock drills where we actually, have people pretend to be patients and stuff. But, you could drill for everything. And I think you can only prepare yourself for so much. But when something like this happens, it probably, exceeds anybody's preparedness and drilling. There's something different about this one.
Yeah. So you had a lot of residents there that day, and as somebody who is a teacher as part of your job, what do you hope that those residents take away from this experience?
Well, I think everybody takes something of their own away from this. I think each individual sort of deals with them on their own level. I think as an educator, as an emergency medicine physician and a teacher, I think one thing which we all learned, which, if there is any possible silver lining as this event, is that it really came to light about what our specialty does and what we're capable of. And I think this is one of those events that really pushed the envelope of healthcare and emergency medicine and emergency preparedness. And it was enlightening to really get a good view of the potential and the capacity of what emergency medicine and the people who train in emergency medicine are capable of doing.
Finally, one last question.
Sure.
If you could tell clinicians in other emergency departments something to do today that they may not have been doing before this, what would it be?
It's a great question. I think, from my perspective, I think it really is appreciate the people you work with. Mm-hmm. I keep getting back to that, but I think of all the things that I took from this event was the people involved on both sides of it. I can't tell you how much awe and respect I have for the victims in a way, and it doesn't sound right, but what I mean is how they handled it and what they went through, and then went going forward, and how they handled all the difficult time and this difficulty to face them. But at the same time, I was in complete awe with how our people, the people at BMC and the people who work in the emergency department, came together and did what they needed to do and just stepped up. And, a couple of our people, for instance, had family members who were very, very close to the bombing event. They knew their friends and family were there at the finish line, which is where the bombs went off. And they came, and without knowing the health and well-being of their friends and family, they came to work and started taking care of strangers, not knowing that their loved ones were okay. And that says a lot about people.
Sure
that,
does.
they were scared and they were concerned, but they were able to step up and do what they needed to do. And I think, that's my one take-home, is to sort of look around and realize the people you're working with in this specialty are really special people.
Well, I want to thank you so much for spending time with us today, Dr. Ulrich.
My pleasure.
That was our 162nd edition All earlier conversations may be found at podcasts.jwatch.org. We come to you from Journal Watch. I'm Joe Elia. Thank you for listening.